Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is September 2nd, and this is our weekly COVID update. I'm here with Ashley today. Do you want to say hello?
Yeah, hi, I'm Ashley Kempf. I am a contact tracer, COVID investigator for the health department.
All right, thanks for being here today. I'm interested to talk to you about contact tracing today. I feel like people hear the term contact tracing thrown around, but people may not know exactly what it is and how it works. So I'm hoping you can start by telling us what contact tracing is and why we do it.
Okay, yeah, I mean, during this pandemic, contact tracing has been super important, not only just to inform and educate the public about COVID-19, but just to protect the community and just kind of keep everybody aware if they've been exposed to COVID somehow, and just kind of help track it and prevent the spread of COVID-19 in the community.
So can you tell us a little bit more about what your role is as a contact tracer?
Yeah, so my role as a contact tracer is just to reach out to different people that are positive in Wyandotte County and just kind of touch base with them. We have a series of interview questions, like where they've been exposed, to how many people that they have in their home that are experiencing symptoms, what kind of symptoms they're having, if they were at work, school, different events in the county or community 2 days prior to having symptoms, just to kind of try to track it and see if they've exposed large groups of people. So it's just to kind of review where they've been at 48 hours prior to symptoms, and if they have any questions about quarantine orders, any thing about like the vaccinations, just really just to answer any of the questions. A lot of people are fearful, and they just don't know a whole lot about COVID-19. So it's just protect their households and other people that they have exposed.
Okay, so basically seeing while they were infectious, if there's anybody else they were around, that sort of thing.
Correct. Yeah.
Okay. So it sounds like contact tracing helps us see how COVID spreads, helps prevent, further spread, so people who've been exposed will know that and know what to do. But if someone gets a call from a contact tracer, can you talk about what they should expect?
So they should expect just a series of questions. We won't get too personal. We're just trying to protect the community. So we won't ask things like, hey, what's your bank account information? What's your social security number? We just kind of verify, their address to make sure that they live in Wyandotte County, people that they may have been around while infectious, people in their household to see if they have any positive COVID results, if they have any symptoms, where they have been in the last 48 hours prior to symptoms. So just kind of just basic information. If they were working, if they need letters for their employers to verify that they are in fact positive for COVID-19, different school exposures to provide letters for schools, just to kind of help them, walk through their COVID experience, because it's been very stressful for a lot of families. So just kind of answer any questions that they have about the orders, the quarantine period, just different things like that, to provide any like community resources since they've been off work or they missed school, or had any financial situations pop up. We help with that stuff too.
Okay, so you're talking about different things that you help people with how much they've been impacted by COVID. Can you talk just a little bit more about the types of resources that are available for folks that you help people with?
Sure. So, in order for people to stay quarantined, we ask them to stay quarantined anywhere from 10 to 24 days, depending on their situation. So, we want to make sure that they have food in their home for them and their families, that they are able to sanitize their home. So, we provide the cleaning supplies and different things like that. We deliver them within 4 to 6 days. We contact them, drop them off on their porch or doorstep without contact, and just kind of go from there. We have community health workers that we partner with that assist with rental assistance, utility assistance, or unemployment, anything that they currently are having trouble with. We just kind of have the community health workers reach out to them and just kind of triage their situation. So it's been very helpful. A lot of people don't know that we offer those services, and they're very thankful for those. I've gotten a lot of positive feedback on what we offer through contact tracing. So,
That's great. Those are really important resources because I know that, I mean, this can be tough for anyone, but especially if you do have to quarantine at home. Um, so you've touched on this a little bit, but just to kind of wrap us up, can you talk about why it's important for someone to participate in a contact tracing call if they've tested positive and they get that phone call?
really it's just to protect the community. Anybody that they have, exposed, and that person is walking around or going to work or going to school and they haven't realized that they've been exposed. It's really just to inform and educate and protect Wyandotte County because the job that we have as contact tracers is just to really help track and prevent the spread of COVID. So it's really important if we can stop it in its tracks, we can prevent people from spreading it all throughout the county and everywhere else. So,
All right. Well, thank you so much for talking about this with us today. I want to just close out by letting folks know that we've talked about what happens if you test positive and you get that contact tracing call, and just remind folks that free COVID testing is available. You can find out more about that at wicokck.org/COVID-19. There's a button there specifically with testing information. All right. Thank you so much. We'll see
yeah,
you
no problem.
next time.
All right. Thanks.